Good morning. Uh, if you're watching us from East Africa, and good evening, and welcome to our special discussion this morning about kidney health that is in Uganda and Africa and the world at large. My name is Mr.Selfcare, and I will be your host this morning. Today we want to talk about something or a body organ that all of us have, a disease that is becoming a silent killer in many parts of Uganda and the world at large. We want to talk about the kidneys. We want to talk about kidney disease. We want to discuss kidney disease. A few weeks back, we've been commemorating the World Kidneys Week or World Kidney Day, where different renal specialists or kidney specialists have been discussing kidney disease. I know, or we now know, or every family at least has tasted the pain of having someone suffer from kidney issues or kidney diseases. Most times it ends up with a lot of fundraising, especially if it involves issues like a kidney transplants. Sometimes some families end up selling properties in the process of raising money if their patients end up in dialysis rooms or on dialysis machines. This morning, we are going to be joined by an expert, someone that has been on the bedside, taking care of thousands of people that have been sent in a dialysis department, and actually the biggest dialysis department, government dialysis department in Uganda. We want to look at the kidney disease. We want to understand why so many people call it the silent killer. Okay. Many times, by the times we see the symptoms of our kidneys, so many times the kidneys have already been damaged or have already reached a critical stage. Across Africa, thousands of people are discovering kidney diseases very late, when actually treatment options are limited. But the truth, friends, is many kidney diseases are preventable if only the public, or if only we understood the early warning signs, the risk factors, and the lifestyles that can help to protect our kidneys. Today we are going to have this discussion around. I want to ask you, whoever is watching it right now, to be generous enough to share or to invite someone to watch along with you. This could actually save their lives. But also, I want to ask you, if you're watching and you like this page and what we do, to take a step right now, boldly step and subscribe and be part of the growing numbers of viewers that are watching every week to the different programs that we do have. Join me as we welcome Mr. Nicholas Sali, all the way from Chirudu Hospital. Good morning, Mr. Nicholas.
Good morning, Mr. Jonathan.
How are you, sir?
I'm okay. How is your afternoon or evening, that side of the world?
My afternoon is pretty fine. How is Chirudu Hospital and how is the renal department?
Chirudo Hospital is good. Our renal department is also good.
Yes.
There's very many patients who are flocking the department.
Okay. So let's start with a simple question, Mr. Nicholas. What are kidneys? And in simple terms, what do kidneys do in our bodies?
Thank you so much. What are kidneys? Literally, kidneys are bean-shaped organs that you find at the lower back on each side of your back. When you touch your ribs and put your hand behind your back where the ribs end, on either side of your back, that's where the kidneys are located. Actually, each kidney is the size of a fist. When you do like this, your fist, so that fist is literally the size of your kidneys. So what do they do and why are they important? Now, the main job of the kidneys is to be able to filter blood and be able to remove the waste and extra fluid from your body. So the kidneys, when they filter the blood and remove the extra waste and fluid, it comes out as urine. So when we see urine, it is just basically the waste being removed and the extra fluid that is being removed from your body. Kidneys also regulate our blood pressure via a system called the Renal system. They balance our electrolytes, especially the sodium. These are salts, sodium, potassium, calcium, phosphates. So they help the body keep them in balance, not to be very much in the blood and not to be very low. Kidneys also make hormones, especially the biggest hormone that the kidneys do is the erythropoietin. This erythropoietin is the hormone that helps to stimulate the production of red blood cells. And the kidneys also activate vitamin D. As we know, vitamin D is very important in our bodies because it helps to absorb calcium, and calcium helps to strengthen our bones. The kidneys don't end there. They go on and even help in controlling the acid-base balance, keeping the pH of the blood steady. Blood not to be acidic and not to be alkaline. So those are some of the functions of the kidneys. So one might ask themselves, how does the kidney do this work? In simple terms, when blood flows to the kidneys, inside the kidneys there are very small, tiny filtering cells that we call nephrons. Now, these nephrons are the ones that help to filter the plasma. When you look at blood, if you extract your blood and put it in a syringe and left it for some time on a table, you'll find that the blood has separated into two, the cellular part and the plasma part. Now, you find that that part that looks like water, what we call the plasma, that's what the nephrons are able to filter. Now, when they filter that plasma, they reabsorb what is important to the body, like the glucose, some water, some salts, and what is not important to the body, they're able to excrete it out in form of urine. So this urine is collected in the collecting ducts, sent into your tubes that take the urine to the bladder. Then when the bladder feels it is full, you get an urge to go to the toilet and pass this urine. That's how the kidneys basically work.
Wow. Thank you so much, Mr. Sally. I've never had someone so eloquent talking about kidneys like you've explained them. I think even my 5-year-old daughter, when she listening, she would properly understand what do kidneys are. How many kidneys that someone have, and what is the consequence of having less than that number? And are some people born in anyway with less than 2?
Ideally, a normal person is born with 2 kidneys. But there are some abnormalities where one is born with 1 kidney. But you can only tell that you have 2 kidneys after doing an abdominal ultrasound scan and be able to visualize the organs inside. So if you have not done an ultrasound scan to see, then it is very hard to tell whether you have 1 kidney or 2 kidneys. Now, having 2 kidneys or 1 kidney, you can still function the same way. 1 kidney does not function to its capacity, to its full capacity. If you have 2 kidneys, you find that each kidney is operating at around 40, 60, 50, 50, 70, 30, but no single kidney operates at 100%. That's why when a person does a transplant, a kidney transplant, they're able to survive with 1 kidney because that kidney is going now to optimize all its cells to function at 90 or 100%. That's why we are very okay with the person donating their one kidney and remain with one kidney, because we know if that one kidney will do all the work for them. When you have the two kidneys, they supplement each other, which is a good thing.
Okay, in other words, you're saying if one person has two kidneys, both don't perform at 100%. When one has one kidney, then it almost performs at 100%.
Yes, that's right.
That is very. What are some of the other abnormalities that we normally see with kidneys, apart from one having one kidney? I've heard people say horseshoe kidneys, ectopic kidneys. Can you explain to someone listening in what could the other abnormalities be on kidneys?
Thank you so much. Normally, like you have said, the abnormality normally range from structure issues to acquired diseases.
Yes.
Now, with the structure issues, like what you have just talked about, the horseshoe, some people call it ectopic. Now, when we talk about these congenital birth kidney abnormalities, these are abnormalities that a baby is born with. You are born and your kidney already has that abnormality. Now, when we talk about an ectopic kidney, it means your kidney is located in an abnormal position. Normally, because the kidney is supposed to be just below the rib cage in the back, you'll find it is now located down towards the pelvis. So when we find that the kidney is located in an abnormal position, especially not where it's supposed to be, that's what we call an ectopic kidney. Then with the horseshoe kidney, normally you find that your two kidneys are fused and it is now one. It is fused together and it is forming it looks like one kidney, because when your two kidneys come and fuse, that's what now we call a horseshoe. Now, when they fuse together, they form a structure that is like this, like a U. So when you do an abdominal ultrasound, you'll see that U shape, which looks like a shoe of a horseshoe. So that's what we call a horseshoe kidneys. It is just the fusing of your two kidneys to form that U shape that is seen on ultrasound. Other congenital abnormalities you can find is, for example, if you have one kidney, what we call agenesis, renal agenesis, or if you find that a baby is born but with already hydronephrosis, you find that the kidney is enlarged, one part of the kidney is enlarged, especially at the part where our urine is supposed to be leaving the kidney, because maybe you may have some blockage somewhere in the tract, in the tubes that are leading this urine out, leading to build up of fluid around that area, especially in the renal pelvis, and it enlarging. Those are some of the common structural abnormalities that a baby might be born with. Now, when you look at the kidney abnormalities, now these are the diseases. For example, you may have a genetic disorder where you find that inside your kidney, you have very many small cysts that are filled with fluid, what we call polycystic kidney disease. Now, with this, because of those small cysts filled with fluid, they continue reducing the number of cells that help to filter your blood, the ones we talked about as nephrons. Now, when these ones reduce, it means even the functionality of your kidney is going to be reducing. This can end up leading to your kidneys failing. Then we have other abnormalities like kidney stones. Hope you have heard of stones in the kidneys. Normally, when they talk about kidney stones, literally they're meaning those solid crystals that form inside the kidneys and they block the urine. Normally, they travel because they're crystal-like. When they reach the tubes, they try to block off those tubes. So the urine that is already formed is unable to travel and leave the kidneys. So it is reabsorbed. And what you are reabsorbing are wastes, which are going now to start destroying your cells, your nephrons, and it may lead you to kidney failure. Other abnormalities of the kidneys can be a glomerular disease. There are some people who are born with the SLE, what we call systematic lupus erythematosus. Now, if you have such a disease like SLE, it can cause inflammation of your nephrons, what we call the lupus nephritis. And when this nephritis means you are getting inflammation of your nephrons, the disease is attacking your nephrons. And when your nephrons are attacked, they're going to be destroyed. When they're destroyed, it means the functionality of your kidney is reducing, and this can lead to your kidney failing. Other glomerular diseases we can talk about is the IgA nephropathy. These are immune diseases where your immune system ends up attacking your nephrons and destroying them, and you end up with failure of your kidneys. Another abnormality is the acute kidney injury. This normally happens and is very common, the sudden decline in the functionality of your kidney. But this one, the good thing with the acute kidney injury is that it is reversible. If you get care in time, you can reverse that injury. This one normally happens if you get anything that causes reduced flow of blood to your kidneys, and you end up damaging the nephrons. So if you get prompt care, you can reverse the acute kidney injury. But if it is a CKD, what we call the chronic kidney disease, this one normally it is long term. The kidneys, your nephrons get damaged slowly over a period of time. And after a period of time, your kidneys are unable to filter very well because the filtering units, the filtering cells, the nephrons have already been destroyed. This one is normally caused by chronic diseases like diabetes, high blood pressure. We shall see in front there those common drivers of chronic kidney disease.
Wow! Again, if you're just joining us, we are discussing the kidney disease. If you've been a little observant of late in the media, we are almost last few. I think was it last week, but one when we're celebrating the International Kidney Day, when we are looking at kidney health. A lot of people are suffering today with issues to do with kidneys. Now, this was not the case, but because of the increasing change or rapid change in our lifestyle, what we eat, what we drink, people not taking a lot of fizzy drinks and less water, like how Mr. Sai is going to explain, we are seeing a rise in the number of actually people presenting in hospitals or in emergency departments with issues related to kidneys. So we feel it is very important that we have this discussion today to actually see how we can take care of our kidneys. And unfortunately, most of the time, by the time we see most of these signs, it is already too late. I happen to work in ultrasound scan, but most of the time, most of these actually kidney diseases, you find them by mistake. Either a mother is pregnant, then she has come, then you only to scan, you're finding maybe hydronephrosis sometimes are related to pregnancy. But even in men, sometimes someone has gotten an accident, only to scan them and you find them with renal stones, they have stones, they have renal cysts, they have glomerulonephritis and things like that. So we are glad to have an expert with us that is going to help us understand, basically understand more about renal diseases. Mr. Sali, how big is the problem of kidney disease in Uganda? And why are people discovering it a little bit late?
When you look at the burden of kidney disease, basically, when you look at the world level, the global burden basically is between 10 and 15% from the different studies being made. When you look at the African level, basically the studies show it is between 10 and 10 and 24%. Different studies have different prevalences. But when you look at specifically here in Uganda, from the studies that have been made in communities, in our outpatient departments in different regions, by Professor Kalichukula and the group, our prevalence of kidney disease is between 5 and 15% in Uganda. But when you look at high-risk groups, these are patients who have diabetes, patients with hypertension, patients with HIV. The prevalence, the burden increases twofold. So it goes up to around 30%. That is how big the problem is. Now, you have asked about why do we have rate presentations in our facilities. Basically, when you look at Uganda as a case study, most of our patients will always present when they have end-stage kidney disease to hospitals. And there are various reasons. When you look at one of the studies that was shown, that was done in Africa, in sub-Saharan Africa, it showed that 60 to 90% of patients who present in our hospitals normally present when they already need dialysis. And this study literally is not different from what is happening back here at home in Uganda. When you look at where I work in Chirudu National Referral Hospital, basically almost 70 to 90% of patients we receive in the hospital with kidney disease are always presenting as emergencies who need dialysis already. And the reasons are very many. One of the reasons why patients present late is because we have very low awareness of CKD and its risk factors, especially among the public, but also among the health workers. Of recent, like the host was saying, we are celebrating World Kidney Day, which as Uganda Kidney Foundation, we had our celebrations in Hoima to cater for the Midwestern region. And when we're interacting with health workers in that area, we found that the awareness also among health workers in the region was also low. So when we have low awareness, especially in the public and in the health workers who are supposed to educate the public, then it becomes a very big problem, because then their patients will not come to the hospital in time. But as Uganda Kidney Foundation, we are trying to address that. And one of the ways we are trying to address that is going onto the media to be able to educate people the risk factors and why it is very important to do a kidney screening. Second factor why people present late is because there is limited access to routine screening, especially at the primary care levels. Now, when we talk about primary care levels in Uganda, we have different levels of primary care. We have a VHT at the village level. We have the CHOOS at the parish level. We have Health Center 2 still at parish level, Health Center 3 at sub-county level, Health Center 4 at a county level, Health Center 5 or district hospital at a district level, a regional referral at a regional level, and national referral. Now, at the different levels of primary care, you find that the only level of screening for kidney disease is at district hospital. That is level number 5. You can imagine from level 1 to level 4, you have limited care, limited access to screening for kidney disease. So that is another big problem why we receive these patients late. Another big challenge is the financial barriers, especially to healthcare. You find that even where we have access to screening, a person needs to pay some money to do the tests, because you find that we have some private facilities in the area which can do the screening, but you need to pay for those diagnostic tests. And the tests to screen for kidney disease are simple tests. Basically, you do a urine test and a blood creatinine test. These are simple tests that can be done, but we still have financial barriers to these diagnostic tests, especially at the primary care levels, from the village up to Health Center 4. Then another problem is use of these nephrotoxic medications and the herbal drugs, those herbal remedies. Basically, our patients, when they are not feeling well, they first learn to use herbal medicines. And when these herbs damage the kidneys even more, that's when now they start running hospitals. We shall discuss that in detail. Another big challenge is the stigma, and there is that mentality of fatalism, where you find that people have that belief that the Baganda call it that these events are predetermined, so they are inevitable. So people still have that sense of fatalism that keeps them very far from the hospital. When the person has a problem, they say, I think it was meant to be. It is God's will. Me still don't believe that when a person dies, it is because of God's will. Sometimes it is because of our negligence. We did not do what we were supposed to do. That's why the person has died. But because of that fatalism mentality, we always say, it was meant to be. So because of that, we also find that we are having patients coming in late to the facilities.
Wow. Thank you so much, Musawo Nicholas, for that well-defined discussion. And again, I always also tell people on this page that I also don't believe that we are dying of preventable diseases because God is calling us. Baganda say, hey, God has called him or God has called her. And I always ask them, why does God want to call us at a younger age? And he calls Chinese and Americans at the age of 90 or whatever. Does he love us so much? So this is really a very important situation and disease when it comes especially to prevention, because this is a highly preventable disease. Mr. Sale has clearly put it that most of the people, especially in Uganda, we get to know you have kidney disease when it is actually an emergency state. But truth be told, these diseases take years before they reach that stage. By the time it becomes an emergency situation, you've been with the kidney has been getting destroyed or getting damaged for over +5 or even 10 years, but without either taking a simple test or taking care. Mr. Nicholas, let's talk about the major causes. What are the major causes of kidney disease in our community, and which groups of people are at most risk today, especially in Uganda?
Thank you so much. Now, the major causes of kidney disease in Uganda, when we look at the studies, the biggest driver of kidney disease is hypertension and diabetes. We are having a very high prevalence of diabetes in Uganda right now. And my hospital, being a national referral hospital, we receive very many patients with diabetes. And the majority of these patients who come with diabetes, most of them are already experiencing kidney disease. They already have diabetic kidney disease. And because the good thing is when they come to our hospital, we screen them for kidney disease. But we have very many patients with the diabetes, with hypertension out there who don't come to my hospital, who go to other facilities, and they don't get chance of screening for kidney disease. Now, when you look at diabetes and hypertension, even in the world and the Africa at large, they're still the leading causes of chronic kidney disease. When you have uncontrolled high blood pressures, pressures that are above 140 systolic, above 90 diastolic, these pressures progressively, they start causing sclerosis of your nephrons. And when the nephrons get sclerosed, it means they're going to die off. Every time a nephron dies, it cannot be replaced. You see, a person is born with literally 1 million nephrons in each kidney. So now when you start destroying these nephrons one by one because of uncontrolled blood pressure, time is going to reach when you have destroyed almost all the nephrons. When you look at studies, books say that by the time you see an increase in your creatinine levels, it means you have destroyed 50% of your nephrons. Just a slight increase in your creatinine levels is just a clear marker that you have destroyed 50% of your nephrons in your kidneys. So, high blood pressure, that is the biggest cause of chronic kidney disease. Diabetes is the second cause. But now when you look at the many studies that have been done, it is showing you that especially in urban centers, diabetes is very high. In the peri-urban populations, hypertension is very high. So these two are the biggest drivers of chronic kidney disease. We have other causes like glomerulonephritis and infections. Now, when you get some infections, for example, infections of the throat, especially with streptococcus, these or infections of the skin with streptococcus. Now, when you get those infections, what happens is that the body will try to come and fight for you, fight on your behalf, these infections. When the body comes in to fight these infections, what happens is that that infection, which is now an antigen, will combine with the antibody that has come to fight it and form a complex, those immune complexes. Now, when those complexes move and go into your kidneys, they're going to lodge into your kidneys, into those nephrons, and are going to trigger inflammation. Now, when they trigger inflammation, it's going to start destroying your nephrons. So, these infections, post-infectious glomerulonephritis, and other infections like HIV, which causes nephropathy. We have nephritis of glomerulonephritis, but which is unclear, where we don't know the cause. And the other common infections like chronic hepatitis, these damage your kidneys. We have nephrotoxic drugs, especially for people who are living with HIV. We have the tenofovir formulations, and some patients who are on second line, the protease inhibitors, ritonavir formulations. These have effects of nephrotoxicity. Then we have misuse of NSAIDs or painkillers. Many people, when they feel pain, they run to drug shops to procure painkillers. Now, these NSAIDs, especially diclofenac, ibuprofen, damage your kidneys. We have, especially if you overuse them and misuse them. That's why we tell people that if you're going to use a painkiller, make sure it is by a prescription. First, go see a clinician, let them prescribe for you these painkillers, because most of these painkillers are nephrotoxic. They're going to damage your kidneys. We have herbal medicines. Now, these herbal medicines, most of them, we don't know they're not regulated because we don't know the toxins in these herbs, and the dosing is not very clear. So when you use these herbs, most of them are nephrotoxic. They're going to damage your nephrons. There are other genetic factors. If you are born, for example, with a low birth weight, you are at risk of having kidney disease in the future. There are some other genetic risks that you grow up with. Another important thing that is very common now today is the heat stress. You know, because of global warming, we are experiencing a lot of very high temperatures. And you know, in my country, people live, our economy the way it is a border economy. When you look at most of these people who work in the gardens, they spend a lot of hours under the sun. They end up dehydrated. Now that dehydration reduces the flow of blood to the kidneys, and slowly you start damaging your kidneys. people thought that me, I don't have hypertension, I don't have diabetes, so I'm safe. No, even the environment you are living in, if you are overexposed to the sun, you get a lot of dehydration, you are also at risk of getting kidney disease. So he asked me, what are those groups? What are those high risk groups of people to getting kidney disease? You see, because we don't have a lot of resources, because we are a low income country now in my country, we try to do targeted screening because of resources. We cannot screen everyone because we don't have those resources. But we try to do targeted screening. We try to screen those high risk groups. So who are those high risk groups? If you're a person who has hypertension or uncontrolled blood pressure, you have diabetes, you have HIV, you are above 60 years of age, you have a family history of kidney disease, or somebody in your family has ever suffered from kidney disease, you have been overusing NSAIDs, those painkillers, diclofenac, ibuprofen, for a big period of time without supervision, you have been with recurrent UTIs. This week you have a cannula, you're treating UTI. After 2 weeks, you're again treating UTI for a very big period. And they're just recurring. You have kidney stones. Then you're at high risk of getting kidney disease. So you should be screened for kidney disease.
Wow. This is a very interesting conversation. And again, thank you, Mr. Sari, for sparing your beautiful cold morning to be here with us. Because, I mean, so many people, I think we... sometimes I see the way people are careful with their phones, their cars, taking them for service. But, I mean, it disturbs me the way we are so careful when it comes to our vital organs. For people that have never experienced a challenge of renal health, renal challenge or kidney issues, I want you to take time and visit a family that has someone that goes for dialysis, as we shall look at later, the complication, the cost implication that is involved. If we knew how expensive it is to manage kidney complications, we would do everything possible to make sure our kidneys don't get a problem. And it's such as simple as taking water. Mr. Sir, you've talked about very important things, and in a minute or two, I want you to add more emphasis on how dangerous are painkillers and herbal medicine when it comes to kidney health. You've explained, but I want you to add more light on herbal medicine, because, Mr. Sir, you find a lot of men buying, especially money power. The cause of their money power actually are so many. Some of them are stressed, some of them are just broke. You don't have money, you're going back to a family, and then you expect to function like someone who just won a lottery. You're old, you're having other complications, but instead of dealing with other things, you want to power your money power. So, in almost every trading center in Uganda, there is an old Toyota Ipsam car that has a man or woman that has a very old newspaper with a lot of bottles that have no writing, that is selling a certain herbal drug. And that herbal drug, to me, it is for money power, but when Sally comes after me, it is for TB. If a woman comes, it is for increasing their water or libido. So the same drug is given to people. Can you elaborate more the dangers of herbal medicine? Again, we are not saying that natural drugs or herbal medicine are bad. We are talking about herbal medicine, especially unregulated herbal medicine, whose content toxin we don't know, to your kidneys. Throw light on herbal medicine and the painkillers.
Thank you so much. Let me first begin with painkillers. Now, painkillers, especially the NSAIDs, these are drugs like ibuprofen, diclofenac, high doses of aspirin. Now, these drugs, what they do, they cause acute kidney injury. They cause what we call papillary necrosis. Now, this will always worsen your kidney disease, because when you get papillary necrosis, it's going to reduce on renal perfusion. These NSAIDs will reduce the blood being received by your kidneys, and it's going to cause you interstitial nephritis. Now, when you progressively use them for a very long period of time, they're going to end up damaging most of your nephrons, and you end up with kidney disease. So chronic use of these painkillers, of these NSAIDs, puts you at risk of getting kidney disease, especially if you are not a person who takes over rehydrates your body, or if you already have any other risk factor that is linking you to kidney disease. As you may not know, but it is from evidence that in every 10 people, one person has kidney disease, and they don't know because they have not screened. So you never know, you may be that person who already has a pre-existing kidney disease that you don't know. So if you use these painkillers for a big period of time and they are not supervised, they are not prescribed, so you're just going to be adding on the risk, and you may end up with failure of your kidneys. Let me talk about the herbal medicines or traditional medicines. You know, we have very many preparations, herbal preparations, and these herbal preparations, many of them are nephrotoxic. Why do we say they're nephrotoxic? It is because the ingredients that they use, they are not standardized, and they are contaminated with toxins, and sometimes with very heavy metals. And it is because of that we fear and we limit the use of these herbal medicines. Because they are not standardized and because they are contaminated, this makes them nephrotoxic. When you look at the studies, case reports that have been done, it is clear that the herbal remedies cause acute interstitial nephritis. Some of them cause tubular necrosis, and you end up with chronic kidney disease if you're using herbal medicine. We are not saying all herbal medicines cause a nephrotoxic, but we are saying before you use any herbal medicine, visit your doctor. Let them know the ingredients in that herbal remedy so that they can advise accordingly. If a herbal remedy is standardized and the ingredients are known, then we can know the danger, whether it is nephrotoxic or it's not nephrotoxic. But for those that we find in jerry cans and it's standardized, you don't know the ingredients, you don't know what contamination is in those herbs, I would advise people to desist from using those herbal remedies unless they are standardized, the ingredients are well known, and your healthcare provider is in the know and advises you to use that herbal remedy.
Wow. Again, I want to thank people that are watching in live. I want to thank my family. They are watching in live. I want to thank my friend Tracy. She's watching in live. I want to thank all the other viewers that are watching in live. I thank you so much for keeping it yourself here. Don't forget to ask your question about renal health or kidney disease, because I think this is something that we should all be concerned about, that we should all do everything possible to prevent. Mr. Sally, let's talk about water. So many people say water is the best natural medicine for kidney disease. What's your say on hydration or proper water intake in regards to kidney health?
Thank you so much. When we talk about water, now, keeping your body well hydrated will prevent you from getting kidney disease. How? Because you'll be with good perfusion of your kidneys. When the kidneys are well perfused, then they will not get damaged. But when you reduce the perfusion, anything that reduces perfusion of the kidneys will cause you kidney disease, will cause you damage of your nephrons. Now, water helps improve on the blood volume. And when blood volume is improved, it will improve on the perfusion of your kidneys. That's why we say, take enough fluids. Take enough fluids. Keep your body well hydrated so that you have good perfusion of your kidneys.
That is so good, and thank you so much, doctor, for that, because I normally tell people that and doctor, in terms of water, how much water is recommended? Because that is some question that so many people ask me, especially women. How much water is recommended in regards to kidney health?
Normally, it is 3 liters a day for women and 4 liters a day for men. Wow. That is the recommended intake. The simple rule is, every time you feel thirsty, drink. Because the needs of an individual always vary between on what you are doing, what is the clement levels, and what is your health. So every time you feel thirsty, drink. That is the simple rule. Okay. Yes.
So, doctor, as we're about to wind up, again, I want to welcome questions in the comment section. Please give us a chance to speak to you, give us a chance to get free consultation this morning. Doctor, what are some of the tests that individuals can do to check for the integrity of, for the healthy status of their kidneys, especially people that are listening in right now? Some of them would love to go to their facilities and ask for these tests themselves. What are some of the basic tests that viewers here can go and do this Sunday morning to check on their kidneys?
Thank you so much. One thing to do if you want to do screening, there are basically 2 major tests to check the kidney. But before you do those 2 major tests, make sure you check your blood pressure. Make sure you check your levels of sugars, your sugar levels. So go and first do a blood pressure test, then do a random blood sugar test, and then the 2 major tests to screen the kidneys are do a urine dipstick to check whether you have some proteins in your urine, because any presence of protein in urine shows you that you have some damage in your kidney. The second test is a blood creatinine test. Now, creatinine is a waste that helps us to define the filtration rate of your kidneys. When we find that the creatinine levels are high, it means your kidneys are not filtering very well. That's why the creatinine is left in the blood. It is not a very good marker, but is the marker we use for kidney function. So just go do a blood creatinine test and a urine dipstick. These 2 tests are going to help you know whether your kidneys are having a problem or your kidneys are not having a problem. Maybe before I leave that, I want to tell people about the warning signs, the other warning signs of kidney disease that you should not ignore at all. Kidney disease, the challenge with it, it is a silent disease. It is just like how the organs are silent. They will never give you any pain when they are having a problem. So, kidney disease is asymptomatic, especially in the early stages. That's why it is important to go and do the screening, especially if you are a high-risk individual. In that group of people I've talked about, if you're having high blood pressure, you're having diabetes, HIV, you have a family history, make sure you go and screen, because the kidneys will not show you any sign, any symptom in the early stages. Most of the symptoms will always come in the late stages of kidney disease. But some of the symptoms that you must not ignore when you see it are, in case you get swelling of the feet or around the ankles or even face, please make sure go and see your doctor. In case you get any changes in your urination, it can be how many times you are passing urine, especially at night. If you start passing urine a lot in the night, what we call nocturia, please see your doctor. If you got past urine and it forms a fume which stays for a long period of time without going away, this is an indication you may be having some protein leaking in your urine. Go and see a doctor. If you're having blood in urine, go and see a doctor. If you're having change in the smell of your urine, please go and see a doctor. If you get unexplained fatigue, you all the time you are feeling tired, but you don't know what is causing you to feel tired. Unexplained loss of appetite, unexplained feeling of wanting to vomit, what we call nausea. These may indicate a buildup of toxins in your blood. Please, if you have an unexplained fatigue, unexplained loss of appetite, unexplained feeling of wanting to vomit, go do the screening and see your doctor. If you're having shortness of breath, it could be because maybe your blood levels are low. It could be because you have a lot of fluid that has built up in your lungs. Go see your doctor. If you are a person who has uncontrolled blood pressures, even when you are using medications that are prescribed for you, please go see a doctor. These may be signs of kidney damage. If, for example, you get sudden decrease in the amount of urine you are passing out, this is an emergency. Run to the hospital and do the screening for kidney disease.
Wow. Again, to our viewers listening in, I think your morning is wonderful, and I think we are really doing something to save the community. The number of people suffering with kidneys is on the rise, both in Uganda, Africa, and the world at large, and this is attributed to so many things that we can actually look on. Doctor, what are some simple lifestyle changes that people can do today to protect their kidneys and also prevent kidney health?
First things first, control your blood pressure. If you make sure you control your blood pressure, let your blood pressure always be below 130/80. Reduce salt intake. Many of us want to take a lot of salt. Use very little salt in your food. But you can enhance your food to have good taste by using those ingredients. The onions, the tomatoes, these supplement on the salt. So use little salt and use ingredients in your sauce, in your food. Weight management. Manage your weight. Don't become obese. Do regular physical exercise. Waking up early at 5 a.m. and do a jogging is very healthy. It will prevent you from getting kidney disease, to also protect your heart. Limit on alcohol intake. These scenarios of where you want to go and drown yourself in alcohol is very risky, because alcohol is going to damage your liver. When it damages your liver, the liver will cause your kidneys to fail. And when you reach that stage, there is nothing much we can do for you. You either need to go and do a liver transplant and a kidney transplant at the same time. Because if you are unable to do a liver transplant, then there's nothing you can do. When the liver fails and it is now killing the kidney, that multi-organ failure, we shall just give you palliative care. So limit on alcohol intake. Control your sugar levels. If you have diabetes, make sure you have good glycemic control, because if you don't have good control of your sugars, you're going to end up with nephropathy. Most people, when you have diabetes and you are seeing a diabetologist or you are seeing any physician, they always want to maintain your HbA1c at least less than 7%. So when you're monitoring your HbA1c as a diabetic patient, make sure it does not go above 7%. So that good control of your sugar levels will help you prevent nephropathy and prevent damage of your nephrons. When we talk about exercise, I just highlighted it. What is exercise? Most people, sometimes early in the morning as I'm moving to work, I find people on the road that are doing a walk as part of exercise. If you are unable to do a run and you end up doing a walk, make sure that when you start walking, when you start hearing your heartbeat, maintain that speed for 30 minutes. That's when we term a walk as an exercise. At least fix some time. Normally we say, make sure you have at least 150 minutes of exercise, at least a week. These are very few. This will help you to reduce on the risk factors. Limit on using processed foods. Now you see, in my country, most people like eating chips. You know, chips is the commonest processed food that we have in my country. So limit. I know in other outside countries, you have a lot of processed foods. Limit on processed foods. Because processed foods have sodium, have a lot of salt in them. So if you don't limit on them, then you may not be able to reduce your salt. Take fresh vegetables. Avoid smoking, because smoking will accelerate the progression of CKD. It will also accelerate your cardiovascular disease. Use medications safely. When we talk about use medications safely, like we said, NSAIDs are a big problem. So avoid unnecessary use of painkillers, especially NSAIDs, because we know they are nephrotoxic. Only use prescribed medications. Don't just go and buy and do a refill, because the other time I had pain here. When I saw a doctor, he gave me this drug. Now I have almost the same pain. Let me go and buy that same drug from the pharmacy. Always first get a prescription before you use any medicine, because some medicines are nephrotoxic and they damage the kidneys. Regular screening. If you know you have any risk factor, make sure you do at least twice a year screening for kidney disease. If you don't have any risk factor, at least do once a year screening for kidney disease. Go and do a BP measurement, do a urine dipstick, do a serum creatinine test, do a random blood sugar. This will help you keep yourself safe from kidney disease. Lastly, stay hydrated. Adequate fluid intake is very important. But if you already have kidney disease, especially in between stage 3 and stage 5, please, on fluid intake, follow what your doctor has advised you. Because from stage 3 to stage 5 of kidney disease, we try to restrict the amount of fluid you are supposed to take in. So as we tell people to stay hydrated and take in a lot of fluids, if you know you are that patient who already has kidney disease and you are in stage 3 to stage 5, always follow the advice of your doctor on how much fluid you should take in to avoid ending up in emergency with a lot of fluid build up.
Wow. That was so rich. And again, thank you, Sally, for sparing your time this morning. Doctor, as we are about to finish, you've hinted something. Can you throw more light on alcohol abuse and the kidneys? And actually alcohol abuse and the kidneys, then more light on salt, because I had a presentation about salt here, and and one of the things they were saying that one of the things could be responsible for actually damage of kidneys today is excessive salt intake and excessive sodium in our blood. Can you throw more light on alcohol abuse, smoking, and then salt?
Okay, thank you so much. With alcohol, when you consume a lot of alcohol, remember alcohol is a diuretic. It causes you to go and pee several times. For those who have been in bars, this is very evident. When a person is over drinking, the number of times he visits the toilet are very high. Now, because it does diuresis in a person, it ends up causing dehydration in this person. So when you overtake alcohol and you don't hydrate yourself, it is going to cause you to lose electrolytes, and you'll end up with imbalance in your electrolytes. Remember, every time you go to pee, you are losing some electrolytes. So that dehydration that is going to be caused by the alcohol because of over-consuming a lot of alcohol, the dehydration is going to reduce on the perfusion of your kidneys, and you end up with electrolyte imbalance. So that is in simple terms. But if I want to explain it now to a layman person, is that alcohol, the way it causes dehydration, it inhibits a hormone that helps the kidney to retain water. That is the simple explanation. When you take in alcohol, it's going to inhibit that hormone that is responsible to tell the body to retain water. You'll end up with passing a lot of water out of your body, end up with dehydration, end up with reduced perfusion of your kidneys, then the kidneys will start failing. But also alcohol can act as a toxin. And when it acts as a toxin, it is going to put a very heavy workload on your kidneys. And when the kidneys are overworked, it hinders their ability to be able to filter the blood properly. Now with the salt, when you are taking in a lot of salt, it causes, salt, when sodium is reabsorbed, it goes with water, it moves with water molecules. So when you have excessive sodium, you're going to retain a lot of water in your body. Now, this a lot of water that is being retained is going to raise your blood pressure because of increased blood volume. Now, when your blood pressure raises, remember we said uncontrolled blood pressure is a driver of kidney damage. So when the blood pressure raises, it's going to speed up the damage of your kidneys. That's why we want to limit how much sodium we take in, because we don't want our blood pressure to increase. Now with smoking, I talked about this, I highlighted it just simply. How does smoking, now with smoking, it contains, we call it nicotine. Yes? Smoking
Yes,
contains nicotine. When you take a cigarette, that content in the cigarette will narrow the blood vessels. The nicotine reduces blood vessels. When the blood vessels narrow, you reduce the amount of blood that is able to reach your kidneys, and you are going to end up with a reduced perfusion of your kidneys. This is now going to damage your nephrons and to progress your kidney disease. By the way, smoking can also lead you to get cancer.
Oh.
It may not be cancer of the throat, it can also give you cancer of the kidneys. Yes.
Okay. Thank you so much, Mr. Sari. Because of the importance and the relevance of this discussion, I want us to end this part one here today. And next time we meet, I want us to look at specifically kidney failure. You will tell us, we shall go through kidney failure stage by stage, what happens, management, and I think that's where we shall end up actually talking about dialysis. But as we conclude, as we are looking at this, so many women normally get issues of hydronephrosis during pregnancy, and so many of them actually they get swollen feet, and most time when they are sent for ultrasound scan, we find that they are having either bilateral or unilateral hydronephrosis. Can you talk about that? And then we shall call it a day, and promise me that next month you will spare some time and we come back and have a discussion on kidney failure.
Thank you so much. I think we shall get time. Hydronephrosis normally is very common in women who are pregnant. And the reason is very simple. It is because you're having mechanical compression of your ureters because of your growing uterus. Now, because your uterus is growing, it will come and compress your ureters. When it compresses the ureters, and remember, you're having progesterone in this pregnant woman. Now, the progesterone is a relaxing hormone. Now, because of the effects of progesterone are relaxing the smooth muscles, and you are getting compression, that's how you end up with hydronephrosis. Most times, if it is severe, it can give you UTIs, and very rarely will it give you renal failure. But it can also give you a renal failure. Most women will always have right-sided hydronephrosis because normally we call it, there is a clockwise twist of that pregnant uterus. And normally it is the right ureter that is normally compressed against your ovarian and the iliac vessels. This normally happens after the 20th weeks of gestation. Although in women who are prime gravidas, it is not very common. Even if it is there, you may not see it. How we manage it? Normally, it is rest. Tell the woman to rest and the woman to drink a lot. And with that, if they rest and drink a lot, normally, you find that in 90% of the cases, just rest and hydration will improve the hydronephrosis. If it fails, they can do some other procedures, like the PCN, what we call the percutaneous nephrostomy, or the double J stenting, but these are very rare. Most women, we do conservative management, just advise them to take rest and keep their bodies well hydrated.
Wow, Mr. Sarah, I want to thank you for this discussion. In 1 minute, what does the Uganda Kidney Foundation do, and where are your offices? And because I would love to have more of these programs, especially from the foundation, even if it is you, even if it is another colleague, to continue the discussions around the kidney, because this is a vital organ in the body. I would love to have more discussion. I would love to know how people can get assistance. I would love to know more about this, because these are organizations that every Sunday I keep hosting here to keep telling us about different organs and how we can keep our bodies well.
Thank you so much. Uganda Kidney Foundation is a non-government organization, non-profit making, health-related organization. And it was founded in 2011 by a team of 3 doctors who were working on kidney patients. And it is open to everybody, the doctors, the nurses, everybody who works with the patients suffering from kidney disease, and anybody advocating for kidney health. The main objective of Uganda Kidney Foundation is patient education about kidney health. So we as an organization, our main objective is to be able to promote awareness through education, so that we increase awareness in the communities, in health workers, about kidney health. We also do health camps, renal camps. Normally, we do on World Kidney Week, during the World Kidney Week, we do health camps, but also throughout the year, we participate, partner with other organizations to do health camp where we do kidney screening activities. We are located on County Mansion, level 3 on Old Chira Road in Kamocha. That's where our head office is. And you can also find us on our website, is ugandakidneyfoundation.org. That's our website. Our vision is to be able to improve the lives of everyone who is at risk or who is affected by kidney disease. And this vision, we want to achieve it, because our mission, we are committed to be able to prevent and manage kidney disease. But the most important thing as a foundation is we are achieving our vision through awareness, community education. We do training and we do research. So our foundation, basically, our main things we do is education, we do research, we even do training. We also help do advocacy for kidney disease, kidney health.
Okay. So again, Mr. Sala, I want to thank you for sparing your time this morning. What are your closing remarks to every Ugandans about kidney health? And then after, you can send your regards to your family, and we can end this discussion here and wait for next time when we come back here to talk about kidney failure as a topic.
Okay, thank you so much, Mr. Moderator. My closing remarks to the people who are listening to us, who are watching us live, is kidney disease can be prevented. If you have kidney disease, we can stop the progress. We can prevent the failure of the kidney if you come to the hospital early. But you can only know that you have kidney disease if you do screening. So I implore each one of us to go to any nearest health facility, do kidney screening, and if you have any risk factor, make sure that at least you screen twice every year for kidney disease. For the health workers who are watching us, every patient who comes to you, especially through the emergency department, or patients who are admitted, make sure that you screen them for kidney disease. because that condition that makes the patient ill to an extent of getting admission can cause the kidneys to fail. So don't have any patient under your care who you don't know their kidney function. For the patients, for the caretakers, and for the public, make sure go screen for kidney disease, because this year our theme for kidney health this year was kidney health for all. We want to protect the planet because we have realized that the climate can cause kidney disease, but also kidney failure can damage the climate. The dialysis modalities that we do leave a very big carbon footprint in the environment, increasing on damaging the environment. So we don't want people to go for dialysis, although it is life-saving. That's why we want to prevent the kidneys from failing so that we are able to protect our planet. I'd like to send my regards to every one of you who has listened to me, to my family back at home in Uganda, to my colleagues I work with in Chirudu National Referral Hospital and Uganda Kidney Foundation, and to everyone that has taken time to listen to us. For God and my country.
Again, I would love to thank you, Mr. Sally Nicholas, for sparing your time to be here today. Thank you so much for taking off that time. We appreciate the knowledge, the insights, and the relevant information that you shared with us this morning. To everyone that has listened in, everything may seem normal. Everything may seem time wasting. We may have taken a lot of your data and time, but I want to tell you, listening in today could have saved you a lot of money if you got diagnosed with a kidney or renal issue. I've had family members, I've lost friends due to kidney-related issues. And so me spending or being here this morning discussing about renal health is personal because I've lost people that I treasure in my life due to this disease. Again, our objective as Mr.Selfcare initiative is to make sure we speak about as many diseases as possible, to give you a chance, to give you knowledge, to empower you to make healthcare decisions that are going to protect your life. I always tell people that we cannot treat all the diseases given the scarcity of resources, especially financial in our hospitals all over the world, given the scarcity of healthcare facilities, the scarcity of healthcare workers. But the best way to deal with healthcare challenges is protection, prevention, and disease awareness. That's why I wake up every morning, send you a reminder, send you that notification message that you always get every Sunday. So to some of you, it is disturbing. To some of you, it is taking up your space. But I'm telling you, to thousands of people that watch, it is life-saving. Maybe this information is not for you. Maybe for you think your kidneys are too healthy to listen to this. I kindly ask you to share this message beyond my contacts, but the people in your contact list. You just don't know whose life that you could be saving. We are going to continue this discussion next month, where we shall be looking at renal failure. We shall be telling you the date. We are going to make arrangements with Mr. Sali and other renal experts to come back here and take us through renal failure or kidney failure. We've all heard about people that are suffering with kidney failure. We've all had people that we are doing car wash for, fundraising for, so on. So we want to look at kidney failure. What happens? What causes it? When do we confirm it? Where does one go in Uganda if they are confirmed with kidney failure? We've had series of trials of renal transplant or kidney transplant. How far have they succeeded? We are going to be hearing all this. But I want to remind you that on Wednesday, we are going to have a session, another session with Uganda Cares, that is 9:30 p.m. And then on Saturday, we are starting a brand new production called holistic Saturdays, where we are going to be hosting people to talk about nutrition, talk about holistic health. And so this coming week, we are going to have a group of people that are going to come and speak to us. On Saturday, 10 a.m. Ugandan time, we are going to have a third program. This is all possible because of the people that generously donate every month to this program. One of them is Olivia Nachisuzi, all the way from California, that keeps donating money monthly to make these programs possible. And all the other sponsors that come in to make this a reality, like AHF Uganda Cares, that makes this a reality. So if you're there and you would love to donate to these productions, please go to our YouTube and look for a button that has thanks. When you say thanks, it's going to give you packages. You can donate as simple as $1, that is 3,700 Ugandan shillings, $10 and onwards. These help us to pay for this app that can connect us with the different health care providers in the world, but also to keep this running in the graphics and everything. We want to thank the generous people that are coming on board to help us. But again, if you're a healthcare professional that wants to come here and educate the people about a certain disease, about a certain rare condition, or if you're a Minister of Health and you want to pass out information, or you are any NGO or national non-government organization that wants to come here and pass on information, you're more than welcome. The page is free. All we want is to create as much awareness as possible. Next Sunday, we are going to be hosting another person that is going to come and talk about what we call rare diseases. There are diseases that are less talked about, diseases like bilharzia, diseases like called jinga, envunza, diseases like skin diseases. We are going to start having a discussion about those. So many people have been asking me about skin diseases. We are going to have a discussion about that. So many people are asking me about family planning. We are still reaching out to family planning organizations, especially in Uganda, to have representatives come and talk to us, because some of these topics, the information change every day. Just like HIV, I couldn't speak about HIV before contacting Uganda Cares because this information is changing every day. That's the same thing with family planning. I don't want to come here and talk about family planning and I give you outdated information. So if you deal or you work with an organization that deals directly with family planning, tell them to reach out to me at chimboa80@gmail.com or consult Mr.Selfcare@gmail.com, and we shall have a conversation on how we can bring them here to make this a reality. Again, I want to thank you for taking off your time. Remember, all of us have kidneys, male and female, boys and girls, men and women, adult and children, and we've got to protect them. From everyone at Mr. Selfcare Initiative, we want to thank you for being part of this morning discussion. We want to ask you to share this with all your family, with all your church, to different church leaders. Can you start playing some of these productions in your church for people to know? Because I think that's one way of preaching or teaching other people about healthcare. Today, our production came live from our studios in Arizona, USA. And we want to wish you a blessed Sunday. May God bless you. See you on Wednesday as we continue to discuss other aspects of HIV/AIDS, courtesy of partnership between Mr. Selfcare Initiative with AHF Uganda Care. May God bless you and have a blessed Sunday. From me to you. Bye.
Why obadde okimanyi tosobola okukeberwa n'okujjanjabibwa endwadde z'ekikaba ku bwereere wano Kalungu Wellness Center ye obulidde bulungi basobola okukebera n'okujjanjaba endwadde z'ekikaba ku bwereere. Jaamu nange nkulage wekiri ekyangu nga waakatuuka osookera wano ku reception n'oyingira n'otuula n'oweewandiisa. Tulina abasaba baffe abalungi abakwaniriza n'omukwano omungi nga gwolina kola kimu kyakukkakkana n'olinda kye bagamba ekiddamu. Weetaaga omuntu w'okwogera naye. Tulina bakansala baffe abalungi abajja kuwuliriza ate tebajja kusalira musango gwonna. N'ekirala bijja kuba byasamba okumanya embeera y'omubiri gwo. Oli mu bwanvu kyenkana ki? Ozitobwa kyenkana ki? Byonna babikola mu bwangu ate nga tebiruma. ng'oteesa okwekebeza akawuka akaleeta mukenenya n'endwadde ez'obukaba zonna bikolebwa wano ate bayita mu bwangu nga tebirudde nawo. Ate bw'oba weetaaga obujjanjabi abasawo baffe bakuwa obujjanjabi obusinga nga bamaze okukebera ate ku bwereere kya bwereere ate nga bakola na mukwano. Tambula yadde okuswala kwonna wano Kalungu Wellness Center. Mujje baabajjanjabi.
Tuyitibwa Kalungu Wellness Center.